Good. Well, welcome everybody. I'm Anna Kowalczyk. I'm the Museum Administrator for the Livingston County Historical Society. Some of you are faces we saw last Saturday. Some of the faces are new. We have a new visitor from the UK in England visiting us via Zoom. So we're really grateful for everybody who is interested in this topic or that we could gather in this way to discuss the 1918 influenza pandemic. Clearly, there is an interest in this topic. Some of our chit chat as we were starting before we muted ourselves was about how many people's ancestors and families were affected by the 1918 Spanish flu, and likely those same COVID stories, will be collected as well. Obviously, COVID-19 has impacted everybody in some significant way too. A few housekeeping things before I start. We do hope that everybody can mute themselves. There'll be an opportunity perhaps to unmute if you've got some questions, but just to keep that background noise down, that would be terrific. The chat room is open. If people have questions, they want to type them in there, I'll keep track of them and we'll pause midway and allow you to unmute yourself and ask your questions, and we'll do it again at the end. That worked pretty well last time. When the presenter does open his PowerPoint, if you want to maximize seeing that, when you have at the top of your screen it says view options. If you click side by side view option, you'll be able to see his presentation in a larger way instead of all of our faces and boxes. So last week we talked about series 1 was introduction of epidemiology and the background. And this week we'll be focusing on the first wave, which was the spring of 1918. Our presenter, David Pompliss, earned a Bachelor of Science in American History and Political Science from Empire State College and a Master's in Social and Public Policy from Empire State. He wrote his master's thesis about the 1918 influenza in Livingston County. And he is currently working towards his doctorate in education. And so I'd like to pass the baton to David and get started on week 2, the first wave.
Okay, thank you, Anna, and welcome back, everybody. Like as Anna said, I see cameras on, so a lot of familiar faces and some new ones. So last week, we really just laid the groundwork. We looked at the background and the epidemiology, setting the stage for the events that were to come. A historian who I really like, his name is Alfred Crosby, and he's a pretty reputable, famous historian, and he did a lot of work with the 1918 flu epidemic, but he also does other scholarship. And one of the books that he wrote talks about how do we study history? How do we write history? And Crosby basically argued that historians, sort of like artists, will play with scale. They'll zoom in and zoom out. And that's what we're going to really start doing today, because I want to start looking at and showing how and where Livingston County fits within the national narrative of the 1918 flu epidemic. So we're going to start zooming into Livingston County and then out of Livingston County a little bit today. Next week and the following week, it will be Livingston County heavy, because I think what's interesting, what sort of jumps off the page at me is this. The first wave of the epidemic, Americans are going about their lives. They're not necessarily nervous about it. They're not really thinking about it. At best, it's a small seed in the back of their mind. It's nothing they're concerned about. And even though historians, when they look at any topic, there's always debates. There are always new ways of looking at things. But over the course of time, historians will come to a consensus, things that they do agree on. And that's where you get the narrative. Once you understand the narrative, you can then go back and start picking it apart. So the narrative that I'm going to put forward is the narrative that historians largely agree on. And what jumps off the page is Livingston County, I think, for the first wave of the epidemic, fits that narrative. It fits right into the narrative, that popular narrative. How are people looking at this? What are people thinking about this? Well, people weren't. Not a lot. And it was the same in Livingston County. But what's interesting is once you start getting into that second and third wave, Livingston County breaks from the national narrative. They're very different. You would not be able to take some of the conclusions reached by historians like Alfred Crosby and apply it to Livingston County. A lot of the histories that are written of the 1918 flu epidemic look at these big cities. They look at St. Louis, Philadelphia, San Francisco, Detroit, Cleveland, all these bigger cities, and they don't really look at small town or rural America. And many years ago, there was an interview done. It was a documentary, like a National Geographic style documentary, and this was many, many years ago. And it was about the 1918 influenza epidemic. And I watched this documentary, and this lady, this elderly lady, she's being interviewed, and she's talking about it. And she's talking about her experiences and her family's experiences in it. And she said, well, whenever we see documentaries or we read a history about this epidemic, it always focuses on the big cities. And she said, I'm from a small farm town in Alabama, and I feel like people forget about us. And I found that striking. It's important, I think, that everybody's story be told. And here, in the case of Livingston County, um, the second and third wave, they're very different. But this first wave, when I say we're going to zoom in and out, it's only going to be to a degree because, again, the Livingston County really does fit the narrative, but we are going to be looking at it. So it's important to remember that I think when we think about the epidemic, we think about, these images of, or the stories that were told, death on an awful scale, um, quarantines, these big public debates about how to handle the issue. That's second wave, not first wave. And last week, we looked at the background in epidemiology. And today we are getting into the epidemic, but it's first wave. So this first wave is occurring in areas that most Americans are able to compartmentalize or separate from their normal lives. Even in the way that they're talking about this in the newspapers, it doesn't sound as though this is something that's going to affect most people. And when it does, it's very much dismissed and downplayed, despite warnings from doctors and scientists that what's occurring is something very, very new and is something that we really should be worrying about. So with that, what we'll do is I'll go ahead and pull up the PowerPoint and we'll start to take a look at wave one, the initial first wave, which is spring and summer of 1918. And really spring of 1918. The flu is around in the summer, but certainly not as much as it was in the spring, even in the cases where it was localized to the Army. And then once you start hitting September and really October, it takes off. So before I go on, does anybody have any questions, comments, anything you would like to discuss before we go into the presentation? No? Okay. So I'll go ahead and I will pull up the PowerPoint here. It'll just take me a moment. Okay. Can everybody see that?
Yes.
Everybody see it? Good. Okay. So the first couple slides of this, it will be a little bit of a review because we do have some new faces, and reinforcing and refreshing is always good. So last week we talked about the background. This is taking place during World War I, and that's really important because World War I plays a key role in the virus's spread. And we talked about the odd symptoms. Influenza it wasn't something new. Um, that people had never heard of. It was common, and they viewed it in the same ways we view it today. It's not that big of a deal. Unfortunately, there are people who die from it, but it's typically those who already have some sort of pre-existing conditions, or the very elderly or the very, very young. But even there, not much of a concern. But the symptoms and the just how quickly people would succumb to it set this apart. And remember, people didn't die of the influenza. What they would succumb to were the pneumonic complications from the influenza. It was that pneumonia we talked about last week. There was, the awful coughing, 104, 105-degree fevers, projectile nosebleeds, lungs would fill up with blood, and that's typically where how people would die from it. They would drown in their own blood due to the horrible pneumonia. So all of these symptoms quickly in the medical community set what was going on apart, and they weren't even sure that they were even dealing with influenza because, again, as we talked about last week, everything was bacterial. They weren't aware back in 1918 of a virus. Even if they used the term virus, it was implied that it was some sort of bacterial illness. So doctors are really, and scientists are really facing something brand new here.
Mhm.
There we go. All right. So again, this a slide from last week, but I think this is kind of where we left off. So we'll begin there. So on March 11th, and again, we're looking at this from the American lens here. On March 11th, 1918, Private Albert Gitchell admits himself to Fort Riley, Kansas, the hospital. Within weeks, nearly 1,000 other soldiers at the camp were debilitated by what seemed to be a new strain of influenza virus. Most likely, um, this soldier was infected in the battlefields of France, and they spread the disease in the United States after returning from the battlefields in World War I. And this influenza, again, it killed more people around the world than the 14th century plague, the Black Death. So again, this is localized. The first wave is starting now, but it's really contained right now for the most part to military. But Fort Riley is not the only military camp that is experiencing soldiers falling ill with influenza. It's starting to happen across the country and in other parts of the globe. People are falling sick, both soldiers and civilians, to the influenza. So there's a lot of things that set the first wave apart and make it very different from what we will see in the second and third. And the first thing, and I think this is really key to understanding how civilians, your regular citizens around the globe, are looking at this. It's defined by high morbidity, which means suffering. People are getting sick, they're suffering, but the fatality rate is much, much lower than we'll see in the second and third waves. That's really important because, and I think we even saw it during COVID at the beginning, right? Yeah, people are getting sick, but it's like the flu. Not a lot of people are dying. It's not a lot to worry about. It was the same thing in 1918. People were suffering, people were getting sick, but a lot of people were also recovering and getting better. So the fatality rate is much lower, which is why people aren't so concerned about it. Though it first appears in March, in the United States I'm talking, this wasn't widely reported in newspapers until April of 1918, and that's mid to end of April. So there's a good month period where it's not even really being reported. Nobody's really talking about this. When people start to talk about it, it's because civilians outside of that soldier population catch the illness and pass away. But even here, the first mention of influenza appears in April health report. There are 18 cases and 3 dead in Haskell, Kansas. Now, those are not alarming numbers. So it's being reported, but the numbers are low and people aren't concerned. And the spread of influenza is sporadic right now across the United States and Europe. It's not this wave of illness. It's happening in pockets in specific areas. But by May of 1918, hundreds of thousands of soldiers are traveling across the Atlantic each month. And when we talked about this last week, that was really critical because the battlefields, those trenches, because World War I is trench warfare, they are hotbeds for disease. You have soldiers living in close quarters, fighting in battles that lasted months, living alongside decaying corpses, rats, and overflowing latrines. These are just hotbeds for disease, and that's really what starts to happen. So Americans initially viewed military-based outbreaks as separate from their daily lives. And this quote, again, this is from last week, a little bit of a callback or review for anybody who might be new. And this is a quote from Alfred Crosby. And he said, while few took notice, something new was seeding itself in the throats and lungs of Americans that spring, which would bury more human beings than the World War. And like war, it preferred young adults as victims. That sounds very cryptic. And it does. It becomes a really awful epidemic. But initially, it did not appear to be anything to worry about. And that's how people were looking at it. This is separate. This is separate from our daily lives. So also, and we looked at this last week, and I think it's important to talk about this in a little bit more detail.
Simply the old grip.
Yeah. The influenza, you'll hear it commonly referred to as the Spanish flu. It did not start in Spain, but people thought perhaps it did because Spain was a neutral country in World War I, so their press was free to write about things other than the front lines or what's going on in the war. So the first major reports come out of Spain. And I think this is kind of interesting. If we look at this newspaper article, the 1918 influenza epidemic had a couple different names. You would hear it referred to as the influenza, the Spanish flu, the Spanish influenza, or grip. And in this newspaper, this is early on, this is first wave clipping. The newspaper's already reporting this as Spanish influenza because the reports of it are coming out from Spain. And last week we talked about how we attach names to these illnesses, such as the flu epidemic that happened in the late 19th century, which probably originated in China, but in America we decided to call it the Russian flu. And you'll see that in this article here. But nothing new, simply the old grip. Only then it came from Russia by way of France, and this time by way of Spain. Well, none of that is true. It wasn't it's simply the old grip. This was something new. The flu that happened earlier did not come from Russia, and this strain did not originate in Spain. But you can see how quickly the press was, especially, to start attaching labels, a way to understand and conceptualize what was going on. And here initially, they're saying it's nothing to worry about. Same old flu, same flu that we've always seen. And in Spain, journalists and doctors, excuse me, disagree about the severity of this. Now, while this newspaper clipping gives the idea that everybody thought this was nothing to worry about, that's also not necessarily true. Things are more complicated than that. There's a debate happening between doctors and journalists as to what this is Is it the same old flu? Is it the new flu? Are the symptoms and illnesses people dying from separate from this flu or a result of it? They just don't know. And some journalists dismiss the impact of this influenza epidemic, as you see here, as negligible, while others were a bit more guarded. But nobody is hitting the panic button at this point. Some doctors, though, were not convinced early on that this new epidemic was even influenza because the symptoms were much more uniform. And again, the lack of bacterial forms within the samplings that they were looking at, because again, they were looking at this as bacterial. So they thought they were looking at something new, and this wasn't actually influenza at all. The medical community doesn't know, and because they don't know, they're not sure how to treat it yet. So this is from a description, and again, because the earliest reports come from Spain, this is a description posted by Ryan Davis in his text, The Spanish Flu, Narrative and Cultural Identity in Spain. And he basically states that a funeral that was making its way along a central street saw, to the amazement of those who witnessed it, the coach driver fall from his seat to the ground dead as if struck by lightning. And one of the mourners keeled over on the ground, having also died suddenly. Panic gripped the others who were part of this procession, and they scattered, leaving the coach abandoned. An ambulance had to come collect the dead, and a municipal guard tied a cord to the horse's bridle, and walking ahead some 12 meters pulled the coach to the cemetery. So it's sort of interesting because here in this first wave, we have these stories, these sort of really morbid kind of grisly stories about what's happening to people. And yet, much of this is looked at as a one-off. This is really affecting largely the troops. Of course, other people are going to get it, but these are one-offs. It's nothing to worry about. And again, that's how people proceeded. That's how people lived their lives throughout this first wave of the epidemic. And so this is kind of interesting. This is from Geneseo, the Livingston Republic. And this just kind of shows you, again, Livingston County very much fits this narrative that we're talking about, that people are more concerned with the war effort than influenza, and that influenza is viewed as an illness afflicting the troops. This is a clipping from the Livingston Republic out of Geneseo at the end of March 1918. Now, by this point, influenza is happening. It's starting to spread a little bit, but the citizens in Livingston County, in this case Geneseo, very much more concerned with the war effort, not so much concerned with influenza.
Yeah.
And a lot of the newspaper clippings reflect that. They talk about influenza, a lot of this documentation, but it's strictly discussing how it's affecting the soldiers. And I thought this quote was neat. And this is something that Americans would become very, very familiar with as the epidemic raged on, just as we're all very familiar with this now. The soldier talking about quarantine. There is to be a dance in the city tonight for the benefit of our company. We can't go, though, on account of that old quarantine. It's like being in a cage, but I've gotten used to it now and don't mind it much. All of Americans would start to really understand how that felt. And I was speaking with my oldest daughter, Mackenzie, about what we're going through now with COVID, and just asked her how she felt about the quarantine. And it was interesting because her words were very similar to this person. She said, at first I hated it. We couldn't go out anywhere. I didn't like it. I was scared. Now, it's just life. And that's kind of the way life would become for Americans. So here in 1918, so here in this newspaper clipping again, local army posts guard against influenza, and it's talking about how they're quarantining. but it's a military quarantine. They're quarantining individuals at the military bases. So again, given that this is localized to, and people are really looking at the military, I thought these pictures were kind of interesting. There's an interview that was given by Dr. Miles Long. He married Ellen Brookins out of Dansville. And this picture over to the left is kind of a neat picture because here you're looking at Dansville in 1918, the year of the influenza epidemic. And over to the right is a picture of Ellen and Dr. Miles Long. Dr. Miles Long married Ellen Brookins out of Dansville, and he served in the Army, and he was a doctor. And in a letter, Ellen Long wrote that he's at the port of embarkation where the boats arrive. Dr. Long treated troops as they were coming off the boats and returning to the United States. In 1966, he gave an interview where he talked about what it was like. And so over to the right here, again, that's Dr. Long in his military uniform with his wife, Ellen, in Dansville. And he's talking about his experiences. And he's discussing the troops. And he says, the troops died like dogs in Hoboken. In Secaucus, they were laying out on the sidewalk in front of the old General Hospital. And it only took a day or 2 days tops to kill them. No one ever isolated the cause, but it was the worst epidemic I'm ever likely to see. And again, this is early. So the military is living in a very different reality than the rest of the country. The doctors and the staff are living in a very different reality from the rest of the country. What they're seeing from the military point of view is the sneak peek of what was going to happen in fall throughout the civilian population. Now, while we had doctors and trained medical experts helping the afflicted soldiers, this next slide, it made me chuckle a little bit. It comes out of Livonia. And you'll see here, somebody's trying to use this as an opportunity to make a little bit of money. So this comes out of the Livonia Gazette. And there's a few interesting things going on here that's very, that really tells the story. I think this clipping alone out of Livonia tells a really neat story about how people are looking at the epidemic. A soldier's strength. So again, we're not concerned with the regular population, with the civilian population. This is limited to our soldiers. Every enlisted man would stand up stronger during the first year service. He could have the benefits of Scott's emulsion, so this miracle tonic apparently, because it fortifies the lungs and throat, creates strength to avoid grip and pneumonia, and makes rich blood to avert rheumatic tendencies. Send a bottle of Scott's to a relative or friend in the service. So you have people trying to capitalize and make some money off of this. But again, it's very much targeted and directed at the soldiers, which I thought was really interesting. So when I came up with this, I thought it gave me a little bit of a chuckle. So there's a little something interesting there out of Livonia. At this point, I'm curious, does anybody have any questions, comments, any thoughts, anything you want to talk about, anything at all? Anna, I know you've been monitoring the chat. Are there any questions or thoughts or stories anybody else had to try to make this a little bit more interactive with people? Charlotte, are you raising your hand?
Yes, I have a question.
Yes, okay.
Can you
Sure.
hear me?
Yeah, I can hear you.
The Civil War also had trench warfare. Is there any evidence that there was anything like this influenza epidemic after the Civil War?
You bring up a really interesting point. So first of all, you're absolutely right. So what's interesting about the Civil War is it's at the Battle of Antietam where the trench warfare really starts. And after Antietam, trench warfare sort of becomes the the norm in the Civil War. There are influenza epidemics that happen in the late 19th century, no major epidemics which are directly tied to the Civil War, but there is disease in those trenches. What's interesting is when World War I breaks out, and this is a true story, there are documents of generals in France, and they're talking about trench warfare, and they're talking about how to handle trench warfare. And they wanted to look back through history to see if there were any other instances of trench warfare where they could learn from. So they're going back and forth about this, and one general makes mention of the American Civil War. He says, well, what about the American Civil War? And the other general says kind of literally, that was just a bunch of Americans chasing each other in the woods. There's nothing really we can learn from there. Well, they were wrong, because when we came in, we were pretty successful at trench warfare because we had already done it. So that's kind of an interesting connection, Charlotte, between the trench warfare in the Civil War and World War I. But as far as disease, any specific epidemic tied directly to the Civil War, not that I'm aware of. That was a really interesting question. Any other questions?
I have a question. You mentioned before that this was seen as something that was brand new. Is that because that the idea of a virus was unknown at that time, or because they hadn't seen this virus?
So the reason that this is looked at as something brand new is because of, number one, the symptoms were so severe. Number two, those who were dying of the 19 influenza epidemic were seemingly healthy adults. This did not fit the strains of influenza that doctors were familiar with. They largely viewed influenza as we do now. And this was something new. Well, they thought it could be something new, a new illness entirely, because it was so different. Typical influenza, people aren't drowning in their own blood. They're not projectile nose bleeding. Their skin doesn't turn an awful shade of blue, and they certainly don't die within 2 days of it. So because it did not fit the mold of what they were used to in typical influenza outbreaks, doctors weren't sure. They thought this could be something new.
Sarah Prinzi, why don't you unmute yourself and ask your question?
Sure. I guess I'm very curious about the handling of this historical narrative. And maybe I'm jumping ahead a little bit too much, because I'm thinking, post Spanish flu pandemic. But, so my mother had told me that my great-grandmother passed away of the Spanish flu, but she felt the need to say, oh, but she had heart problems. And, that doesn't fit now what I'm seeing about the Spanish flu, that detail would be necessary to explain her death. And so combine that with the fact that my experience with history textbooks is that this is barely mentioned, if at all. I'm just wondering, again, maybe I'm jumping ahead too far to the aftermath of this, but the handling of that historical narrative is very interesting. It seems downplayed.
It is. And we're going to talk about that, but let's address that a little bit now. So first, as far as mentioning that pre-existing condition, what's interesting is, and remember, when we say that it was the young and healthy who passed away from it, that doesn't mean there aren't exceptions. There are. There were elderly people who passed away. There are always exceptions. So that is, but again, the elderly tended to fare better because of a similar epidemic that hit in the late 19th century. So they had some immunity to it. But it's interesting feeling the need at that point to mention that there was that pre-existing condition. And I'm not sure why that would be mentioned. Maybe it was because of the view that the elderly tended to survive. So trying to fit with that narrative to say, oh, but she also had a heart condition or some sort of pre-existing condition. But that's kind of interesting because, again, there are always exceptions. So when I make some sort of statement such as this is very much localized to say the military, well, it is, but there are always exceptions. Same thing with the rates of death. there were elderly people who certainly passed away from it. As far as your question about the handling of the narrative, I think that's one of the most interesting effects of the 1918 influenza epidemic. And you pointed out that, and when you say textbooks, just to clarify, are you saying, for example, high school textbooks, what we learn in grade school and high school?
Yeah, I'm a middle school social studies teacher.
Okay.
So I teach American history at the middle school level.
Mm-hmm.
And I've only ever seen the Spanish flu, if it's mentioned at all, as maybe a paragraph.
Yep. Yeah. And in the last lecture, we're going to talk about that in detail. But to address that, what's interesting there is, as a history teacher, it's pretty well known, the 1918 influenza epidemic is a primary reason why World War I came to an end. You can't sustain a war with hundreds of thousands of soldiers when they're dying of influenza, but yet it's not mentioned in the textbooks. Here's what, now, again, this is a debatable subject. Historians, I don't think, have reached a consensus as to why this has happened, but there is a national amnesia to it. What people do, because the suffering and the death during this period of time is on such a massive scale, it really affected everybody. There is an intentional dismissal of the influenza because the American public ties it to the war. And when the war is done, they start to look at the influenza as being done as well. There really is sort of an intentional public forgetfulness about it, but yet deep private remembrances about it. And I think that's interesting because it's reflected in the school textbooks, but it's also reflected in the newspapers at the time. If you go through those newspapers, if you go to an archive and you're looking through the newspapers, if you start in March 1918, you start to see whispers of flu. By the time you get to December 1918, it's all they're talking about. And that continues in January, February, and March of 1919. That's all you read about. Then something odd happens. Around April and May, certainly by May, you don't see mention of it. And I mean that literally. It's done. People don't want to talk about it. They're tired of it. The death was so unimaginable. And the generations that followed that 1918 generation, those individuals who grew up with the stories, largely wrote a lot of the texts we have that we're studying in the schools. And I think it's interesting that collective amnesia is reflected in those history textbooks. I wish I could answer your question a little bit more specific, but I don't have an exact why. But the handling of the narrative is very consistent from the textbooks going back to the documentation in 1918. There's an intentional desire to forget about this through tying it to the war.
Well, that was excellent. Thank you.
You're welcome. Any other questions, or did we want to go ahead and move along? We're getting close to being done, so we're certainly not in a rush here today. We still have 20 minutes, and we don't have a whole lot more to get through, I don't think. But if there's no other questions,
let's continue for now,
continue
David.
on. Sure. Okay. So getting back. So again, prior to this slide, we looked at, medical doctors, especially in the military, the way they're looking at the 1918 flu. And here we see out of Livonia, some guy trying to make some money off it. So again, now while this is happening in this first wave, there are other things going on here that are causing doctors to debate this. First, in the newspapers, the way the deaths are being printed, they're subdividing it. So subdivisions on victims' death certificates further this debate. It's actually kind of making it worse and feeding into the idea that this is not influenza, that this is something new. And doctors are saying a lot about this at the time. There's an example here of Dr. Henry Christensen. He notes that the newspaper subdivided mortality reports from epidemic influenza into deaths from influenza and deaths from pneumonia and bronchopneumonia, when really they should have all been most likely categorized as all the same. But here you have some people dying from influenza, and then some reports where people are not dying from influenza, but dying from bronchopneumonia, when really they're all dying of the same thing. So even there, the way the death statistics are being reported, we don't actually have a really firm idea on the numbers of people who died from epidemic influenza because of the subdivisions. But he stated, this Dr. Christensen stated, it cannot be confirmed if the bronchopneumonia is part of a new strand of influenza or a complication from it. Now, doctors are struggling. If they're struggling to identify what's causing this, they're struggling to treat it. And doctors are debating about this as well. And Dr. Harry Myers, he observes that at first, the coughing is just a bit of an irritant, but it quickly progresses to coughing up blood. And doctors start to decide and debate how to treat this. And at the time, they're using aspirin, and they are loading patients up with cough syrup, loading them up with it, which is causing a lot of gastrointestinal issues, a lot more discomfort. So Dr. Harry Myers, he makes the case that, look, we don't know how to treat this, but we have a responsibility, a duty to lessen suffering. And if we can't cure this thing, we can at least try to start making people comfortable. So when we look at this slide and it says that he starts treating sick people with heroin, we from a 21st century perspective, we could say, I don't know if that's such a good idea. But in 1918, this is what they're working with. And it's not as though this doctor's doing something necessarily unethical. His point of view is, look, we have people. This drug lessens patients' suffering. So there's a debate about whether or not to use heroin to lessen the suffering of people infected, while at the same time, doctors are trying to figure out how to cure this thing. Now, while this is going through armies, it is starting to spread through the civilian population. In Haskell County, Kansas, an outbreak hits a Haskell County Indian school. It's a school for Native Americans. 400 children, out of 400 children, 3 die. So again, it's there, but the numbers do not reflect what's to come. And outbreaks happen elsewhere throughout the country, in Chicago, Detroit. Famously, in the first wave, 1,000 workers wind up sick with influenza at the Ford Motor Plant. But there's a lack of, at this point, there's a lack of documentation in the civilian population about this, so it's kind of hard to track. But also, schools start to spread influenza. So we start to see it throughout this first wave. It starts to spread through the population, but as we talked about in the initial slide, the morbidity rate is high, the suffering is high, but the fatality, the death rates do not seem to be. One place where influenza ran roughshod were in our prisons. But again, it's important to look at this. So what are we really seeing in the first wave? Outbreaks in military, outbreaks in prisons, right? All sort of these institutions or areas where your normal, everyday American citizen is going to say, that's awful, but that's them, not me. It's in the prisons, not in our community. It's in the military, not in our community. Okay, there was a little outbreak in the school. The numbers aren't bad. It was out there, not here. So again, from the perspective of a civilian, even here, it's nothing to worry about. But the outbreaks in the prisons are particularly terrible in the first wave. Infamously, in San Quentin. There's a tragedy at San Quentin. So first of all, this prison has poor ventilation. The sleeping quarters are extremely crowded. Tuberculosis is already spreading through the prison because the sanitation is so bad. What happens is there's a prisoner transferred from Los Angeles County Jail. This prisoner enters the prison with some symptoms. He has, I think it's like 101-degree fever. His body hurts. Typically, what happens is, according to the records at this prison, when a prisoner is transferred in and they are ill, they're quarantined. They're put away from everybody until they recover. Well, in this case, the prisoner was put right into the general population. And once a week, they were allowed to, as the documentation states, go view a motion picture show once a week. So they're in crowded movie theaters with this patient with influenza. They're in the lunch hall with them. They're in the sleeping quarters, and it spreads terribly. San Quentin winds up with one of the worst outbreaks of any prison. By mid-April, nearly 700 prisoners, half the population, are sick. Dr. Leo Stanley's the resident physician. He's known for being unethical, for conducting some unethical medical experiments. And in this case, there are serious allegations that he intentionally put that infected prisoner into the general population to use it as his own laboratory so he can document what happens. There's two sides to this. Number one, of course, we can say that's deeply unethical. But I want to be fair, is that there is documentation from doctors at the time and shortly after stating that it's his records that pushed medicine into the 21st century. It was his records that started to help doctors figure out how to handle this, especially afterwards. Unfortunately, this comes from an unethical sort of medical experiment where he's putting influenza patients intentionally together to spread the disease and then documenting what happens as if this prison is his own lab environment. Now, why this is interesting, and I think connects to, well, first of all, we also have to remember there are employees that work there. It's not just spreading throughout the prison population, it's spreading to employees who are bringing this home. Also, if we look back at the first wave of COVID-19 when it first happened, we talked about in the national dialogue how it was happening in prisons. Well, San Quentin kind of comes up again for the same reason. As COVID-19 was spreading, officials at San Quentin showed, quote, indifference to the plight of prisoners during coronavirus. And the Court of Appeals had to rule by October, it was now just like it was in 1918, a site of one of the worst COVID outbreaks. 75% of prison population infected, 2,200 infected, 38 deaths, 300 employees sick. So San Quentin had one of the worst outbreaks in 1918, and it does again here during COVID in 2020, due to indifference of the plight of the prisoners. But getting back to where we are in the first wave. This is out of the Dansville Express, April 1918. And again, I think it shows how Livingston County fits with the national narrative. Its life is normal. It's talking a snowfall. There's a snowfall this morning. There's an individual spending a few days in Buffalo. And then here it talks about somebody who's home from Rochester. The weather was cold and he had the influenza, same as some people. A brief mention of it, nothing special. It's there. It's nothing to worry about. It's the same type of narrative that we've been getting. And that's from Dansville Express. And if you look at some of the other newspapers in Livingston County, they're talking about graduation ceremonies happening. Individuals are coming into town to visit. Life is moving as normal. By the time we reach the end of the year, the narrative that's going on, the discourse in the public has dramatically changed from what we're seeing in these newspaper clippings to the day after Christmas, the Dansville Express put out this image, which I think is really powerful. Jesus as the Grim Reaper, holding the Grim Reaper scythe, turning the page to 1919. That's how wildly different the newspaper reporting winds up being from that first wave to December. It's almost like we're dealing with two different pandemics. And next week, that's what we're going to get into. We're going to get into that deadly second wave. We're going to talk about how are people handling this? What are they thinking about it? And why and in what ways does Livingston County break from the national narrative? Because Livingston County seems to be a bit unique, and we're going to look at that. So that, I think that's where, as far as the PowerPoint, that's where we leave off for today. Next week, we'll go into wave 2. That being said, does anybody have any additional questions, comments, anything at all?
I'm the historian for the town and village of Leicester. And going through, I've been redoing all the obituary files. And going back into the old obituaries, I have found some places where a family, about this time, the entire family would die within 2 to 3 days. And it never says influenza, it doesn't say pneumonia, it just doesn't say anything. And so I'm just curious, really. I mean, I know it's underreported, but it'd be interesting to see if anybody ever had the time to go back and see how many people in that time period probably died from influenza, but it was not recorded as such.
Yeah, there are some historians who have gone back to look at that. Some of the data is difficult to really gather, again, because as you said, without, the documentation at this point, especially in the first wave, is really hard to wrap your head around because it's not saying pneumonia or influenza, right? Now, historians have gone back, and after looking back at the statistics, you'll now hear statements such as, from historians, 500,000 Americans perish in the 1918 flu, and that's being extremely conservative. Now they're saying in the month of October 1918 alone, there were a couple 100,000. So, and that's going back and looking at records that are incomplete or where the cause of death isn't specifically listed. So because of that, it really makes it hard. But to your point, what we were looking at is how the public is responding right now to the 1918 epidemic versus what we know now, in that first wave was probably more severe than people thought. And that, I think that goes directly to your point. Great-grandfather died in March 1919, no cause of death. Whoever put that in the chat, could you just elaborate on that?
Marshall Smith, why don't you go ahead and unmute yourself and talk about your great-grandfather.
We have in the chat, I have not found a cause
Here,
of death recorded.
here he goes.
Can you hear me?
Now I can hear you, great.
Yes, this is my great-great-grandfather, and he was in Ohio, not in New York. And I'm the family genealogist. And as you've been talking, I've just gone through all of the death dates for my ancestors to try to pin down who might have died from this, the flu. And he's the first one that popped up. But there's no documentation about how he died or why he died. So it's just raised my curiosity and directing my genealogy research for the next week.
Were you able to go to the clerk's office or contact them at all to try to pull a death certificate?
Not yet.
Okay.
Not yet.
That's where I was starting, because the death certificates, especially by the time, but when we're in March 1919, we're in wave 3. By the time we get to wave 3, the documentation on the death certificates is much more specific than you're going to see in wave 1. If you pull that death certificate and he says he died of pneumonia, he got it. He got the flu.
Okay, I'll report back next week.
All right, let us know. Any other questions? We have, let's see, what were the medical treatments developed in the first year? So no, they didn't know how to deal with it. Everything is experimental at that point. But we'll talk about, there are some measures that the medical community recommends that get implemented in the second wave. Any other questions? Anything anybody would like to talk about? It looks like we only have like 2 minutes, but.
Well, somebody had asked that there was no testing, so how did they know how to even document the diagnosis?
So because of the way the symptoms came up, and again, that's another good point. We're looking at a time where there is no, they can't go get tested for H1N1 or flu A like we can now. The only thing they can do is look at the symptoms and draw conclusions from that. And that's basically what they do, which is why they don't know how to handle it, because the symptoms are so different from flu. There's some things that are similar to flu, but it definitely does not look like normal influenza. Gail Mosher, did you want to go ahead and unmute and ask your question?
I was just wondering, there must have been some early folks who took note of this. Was there any kind of early push of mask wearing or just isolating, or was this something new that eventually came out in the pandemic later rounds?
Yeah, so of course, when we look at the military, they're quarantining, and of course the nurses, the doctors are wearing masks. Once you hit the second wave, you're going to see a lot of language that we are now familiar with today: social distancing, quarantining, wearing masks. There's actually a public debate on wearing masks, a big public debate on wearing masks. And you start to see that really more by the end of the summer, going into that deadly second wave.
Well, that's maybe a good stopping point too. Next week, we'll focus on the deadly second wave, the fall of 1918. And we'll meet back here, same time, same space. Feel free to share these links with others. We'll post the links on our website and on the Facebook. So, people that you come in contact with during the week, do you think they might be interested? Go ahead and just tell them to check there, and they're welcome to join us. We're doing our best to record these, and we'll post them at the end of the series, and we'll have some sort of survey at the end that we hope you'll participate in. And again, I would say history repeats itself, right? So that's why we're here doing this today and informing ourselves during this COVID-19 pandemic as well. So thank you everybody for joining us, and we'll see you next week.